Hey everyone, welcome to The Explainer. Today we're unpacking a truly massive, fundamental shift in how we work. I mean, for decades we've all been conditioned to think of software as just a tool, right? Something you use. But what happens when that software evolves? What happens when it starts acting less like a simple tool and a lot more like an actual coworker? Okay, let's dive into this.
So, picture this. Imagine walking into the office tomorrow morning, and a brand new human colleague has joined your team. But there's a major catch. They have absolutely zero formal job description. Yet somehow they've been handed full access to several of your most sensitive core systems. They can draft messages to your clients, update critical records, trigger really complex workflows, and just send work off to other teams. Oh, and they are almost never supervised. Literally nobody is entirely sure who actually authorized their role, who reviews their performance, or, crucially, who owns the outcome if they mess up. I mean, it sounds totally absurd, right? HR would have an absolute meltdown. It's a complete compliance nightmare. Yet as our source material clearly points out, we risk normalizing this exact digital equivalent as artificial intelligence evolves. By deploying advanced AI into our workspaces without a proper, rigorous governance framework, we are essentially letting a rogue, unsupervised employee just run wild in the system.
Now, what's really interesting about this slide is the fundamental difference in risk here between an AI assistant and an AI agent. You know, we've spent the last couple of years getting really comfortable with AI assistants. They sit passively, they draft emails for us, give us faster meeting summaries, they basically boost our own personal productivity. But an agent? That is a massive leap forward. Agents don't just wait around for a prompt. They actually trigger workflows. They reach out and retrieve data across entirely different systems. They take autonomous action based on a broad goal you've given them.
To get really specific about what we're dealing with here, the UK government AI playbook defines agentic AI as autonomous AI systems making decisions and performing actions with minimal human intervention. I really want to highlight that phrase, minimal human intervention. That changes literally everything. You see, the greater the autonomy of the system, the more we absolutely need entirely new arrangements for delegation and oversight. You aren't just checking over a quick draft anymore, you are literally handing over the keys to the car.
And hey, if you're sitting there thinking, well, this is just some distant sci-fi future we have years to prepare for, just look at this number, 505,000. The National Health Service in the UK, the NHS, is deploying Microsoft 365 Copilot to 505,000 clinicians and support staff right now. This shift is happening today at a massive scale and in incredibly sensitive, high-stakes environments.
And the reason they're moving so incredibly fast is because of an astonishing metric, 43. In an early NHS trial across more than 30,000 workers in 90 organizations, they reported an average saving of 43 minutes per staff member per day just on administration. When you multiply 43 minutes by 500,000 people, you are looking at an astonishing amount of freed up capacity. The opportunity is undeniable, and it's incredibly exciting for sure.
But that brings us to a really profound leadership question. As the source material argues, time saved is not the same as value created, right? If we save all this time, what actually changes as a result? Who decides exactly where that released capacity gets redirected? Are clinicians actually seeing more patients, or are they just doing different types of busy work? Ultimately, what actual clinical outcomes improve because of this technology?
We have to ask these hard questions because in sectors like healthcare, administrative workflows aren't just harmless paperwork. They literally shape clinical reality. They dictate what gets prioritized and what actually reaches a professional's attention. A seemingly routine administrative AI summary can completely change what a clinician notices. If an AI writes a summary and happens to miss a vital symptom, well, that's a serious clinical safety issue. Clinical safety guidelines, like the UK's DCB 0160 standard, make it very clear that we cannot just assume administrative tasks are inherently low risk. Governance has to follow the consequence of the workflow, not just whatever the software supplier labels it.
Let's move to and see how this builds. Section 1. The mental model shift from software to delegation.
So delegation is not abandonment. Think about it. When you hand off an important project to a human colleague, you don't just say, "Hey, figure it out," and walk away. You clearly define the task. You set boundaries around their authority. You establish information sources and check-in routines for supervision. We absolutely must apply that exact same managerial discipline to our AI agents.
But before any of those controls can even be put in place, there must be a named, accountable human owner. This is entirely non-negotiable. You cannot delegate accountability to an algorithm. You can't dilute it across your software supplier, your IT platform team, and the end user. According to frameworks like the National Institute of Standards and Technology's AI Risk Management Framework, or NIST, the organization and a specific executive within it inherently owns the risk for any output or decision supported by that AI.
And this brilliantly illustrates Section 2, the 5 rights of agentic delegation.
Right number 1 is the right task. This is all about using what the author calls minimum sufficient intelligence. Leaders really need to start with the actual problem they're trying to solve, not just reach for the newest, shiniest AI model on the market. Ask yourself, could this be solved with a simple template, a basic rules-based automation? You always want to use the simplest, safest capability that reliably completes the work. Choosing an autonomous agent should be a very deliberate choice, definitely not the default.
Right number 2 is the right authority. An agent's technical permissions must strictly, and I mean strictly, match its allowed role. Reading information and drafting a recommendation is one thing, but actually modifying a medical record or sending an automated message directly to a client is a wildly different level of authority. We cannot casually bundle these permissions together just because the software allows it.
Right number 3 is the right data. Your AI agents must use officially approved sources, they must rigidly respect your existing access controls, and, importantly, they need to make their evidence visible. Here's a huge trap many fall into. If an agent fluently and beautifully summarizes poor quality or outdated data, it doesn't magically make that data safe. It just means it's delivering garbage with immense confidence. We have to ensure lawful and safe use of information from the ground up.
Right, number 4 is the right supervision. So the crucial point is human oversight must be meaningful, not just ceremonial. We are probably all guilty of blindly clicking approve on a software pop-up without really reading it, but that is not supervision. A low-risk draft might just need a light check, sure, but high-consequence workflows, like anything affecting clinical prioritization, safeguarding, or legal disclosure, require strong review, robust audit trails, and genuine human control exactly where the responsibility sits.
And finally, right number 5, the right escalation. Every single agent needs an off switch. There must be incredibly clear, predefined conditions under which the AI stops what it's doing and hands the work over to a human. When it encounters uncertainty, when it flags a safety review, or when it hits a metric threshold, it needs a built-in reflex to essentially say, hold on, I am stopping, I need a human to look at this.
When you pull all of this together into your organization, you realize that the ultimate goal of AI governance isn't to hold technology back or stop agents from acting. We want the benefits. The goal is to ensure explicit authority, bounded actions, observable behaviors, and accountable executive ownership. It's really about ensuring we are working safely alongside our new digital colleagues, rather than just crossing our fingers and hoping for the best.
Which brings us to one final incredibly powerful test. Before deploying your next AI system, really ask yourself and your leadership team, would we allow this AI agent to do anything that we would not allow an unsupervised new employee to do? If the honest answer is no, then that agent needs a clearer role, tighter permissions, better supervision, and a much stronger escalation route before it becomes part of your team. Take this mental model back to your own organization. Treat AI as a digital colleague and ensure you're delegating safely. Thanks for joining me for this explainer, and keep learning.